Hello, my name is Robert Brill. I'm a fibromyalgia advocate and doctoral candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss depression and fibromyalgia. I feel like I would be lying if I didn't explain that it's pretty normal to be depressed when you have a chronic illness, to a degree. You should feel depressed or sad about the pain you're in, about the loss you've faced, about the challenges you go through every day, and about the financial difficulties you may face with chronic illness. If you didn't, I would say you're exceptionally strong. It's a fairly natural reaction to a painful outcome, but there's a difference between depression from circumstances in life and clinical depression. It's believed that there is an increased risk for suicide in those people suffering with chronic pain. Fibromyalgia is not so commonly publicized in this category, however. When you consider a disease like fibro that is so misunderstood and further disregarded by the medical community, or even your family and friends, it makes sense that it could easily fit into this category. Suffering with fibro already makes you feel like you are many things, and isolated can quickly become another one. Your emotions can also quickly become tangled, and your needs are typically far from met. We're in pain, we're fatigued, and we have 10 other symptoms, and no one understands. We've seen 8 doctors this year, and none of them have helped. We've run out of money, we're too sick to work, we're worried about how we're going to make it through our next month. Our lives can seem hopeless fast. Then factor depression in. Early on in the illness, like many other illnesses, you may be in denial. Denial is a temporary defense, typically followed by some degree of acceptance. Some people cannot handle the truth, possibly because it breaks down denial. Others use denial extensively in many aspects of their lives. What can be worse is that you may encounter negativity or doubt from those around you, especially those in the medical field, and that can be devastating. Depression can make your symptoms seem exaggerated sometimes, drawing a heavier focus towards a psychological disorder and away from fibromyalgia, maybe blurring your diagnosis. Often there's a grieving process that goes along with chronic pain. The process of reaching an acceptance stage of the illness is not unlike grieving of a lost loved one. If you're not able to successfully transition through these stages of grieving and accept your illness and how it has impacted you, psychological disorders like depression and anxiety will develop. Cognitive behavioral therapy is perfect for these illness-related symptoms. In the last few years, it seems like a revolution began and created a chain reaction in fibromyalgia world. I'd like to say it hit the world like an explosion, but it didn't. It was subtle. But fibromyalgia is slowly gaining forward momentum, and I think soon enough it'll be as valid as many of the other tragic diseases of the 21st century, once thought to be just as invalid as fibro, like depression, polio, lupus, MS, Parkinson's, Lyme disease, Gulf War syndrome, and many more. I think that depression is one of the most serious symptoms of fibro. Not always the one that is on your mind the most, but the one that causes the most damage. Depression can be a valid and significant part of your fibro for many people and needs to be taken more seriously than most of the other symptoms associated with the illness. While depression can be effectively treated with therapy or medication or biofeedback, lifestyle changes, or a combination of these, it's easy to miss the signs and continue trying to live a normal life untreated. Many people I've met with fibro are depressed and in denial. After all, it's not fun to admit you suffer from depression. Let's face it, society doesn't readily accept depression either. Often the symptoms of fibro mimic other illnesses. Sometimes the signs of depression mimic fibro closely as well. As part of your action recovery plan, you should be keeping some kind of journal or written testament to your symptoms for a few reasons, but mainly because identifying secondary illnesses like depression is critical. Plus, you're not likely to identify your depression, and those closest to you may feel awkward telling you if they think you have depression. So you have to keep an eye on these aspects. Thank you.